within the last 1 week. I welcome you to the national briefing by the Presidential Steering Committee on COVID-19 for today, Monday, the 13th of December, 2021. With the emergence of the new COVID-19 Omicron variant now spreading very fast globally, Nigeria has continued to study developments and has deployed science and data to measure the risks to our citizens, especially the dangers of importation. The PSC wishes to assure Nigerians that it has escalated all surveillance and control measures around our country. It has similarly ramped up vaccination of eligible citizens and residents while making provisions for booster shots for those fully vaccinated. The PSC is working with mandate ministries to address the issues surrounding the restriction imposed by some countries on travelers from Nigeria on account of the Omicron variant. While each country is entitled to put in place measures to protect its citizens, Nigeria has similar responsibilities as well. However, based on existing relationships, Nigeria has initiated diplomatic steps to make these countries reverse their course. This is ongoing in the interest of all parties concerned, and we expect that positive results would emerge within the next 1 week. The PSC also evaluated the developments on the relationship between Nigeria and the UAE, and we are pleased to inform you that the position of the federal government is in line with the established ICAO protocols and the spirit of the bilateral air services agreement signed with the UAE. Our sovereignty remains paramount. Mutual respect shall be our guiding principle, in as much as it should be in the best interest of our dear country, Nigeria. The PSC will, at its next regular meeting on Monday, the 20th of December, 2021, brief you fully on developments. We shall now take your questions as they relate to the issues of restrictions imposed on Nigeria, the Omicron variant, and the developments with the Nigeria-UAE relations on aviation. I thank you very much for listening.
Thank you very much, Honourable Minister of Aviation. Let us now invite
members of the PSC, colleagues, members of the press, distinguished ladies and gentlemen. Good evening. As of today, the 13th day of December 2021, 7,894,068 eligible persons have received their first dose of the COVID-19 vaccine in Nigeria. This represents 7.1% of the eligible population required to be vaccinated. The total of the fully vaccinated eligible people in Nigeria is 3,969,325, representing 3.6% of the eligible population. I'm also happy to report that 496 persons have so far received their booster doses. In recent times, we're beginning to see an increase in the number of COVID-19 cases globally due to the new variant called the Omicron variant. In Nigeria, this increased number of cases is due to the fact that most of our eligible population have not presented themselves for vaccination. With increasing travels and interactions these ember months, the virus is still thriving and spreading within the communities because of our eligible populations that remain unvaccinated. The COVID-19 is unable to replicate and cannot survive for long in a vaccinated individual. Our unvaccinated eligible population are therefore providing an environment for the virus to thrive and mutate. The vaccines are available in all our designated public, private, secondary, and tertiary health facilities. We have worked assiduously to ensure that a vaccination center is located near your home your workplace, your school, your religious center, and at the market or shopping mall. This is to ensure our eligible population have easy access to the vaccines. The jabs are available. Nigerians need to avail themselves to protect not just themselves, but their loved ones and their communities. While we call on eligible Nigerians to take advantage of the opportunity in the ongoing mass vaccination to get their regular and booster doses, it is important to mention here that no person in Nigeria has ever and will ever be vaccinated with expired vaccines. The general public needs to be clear on the fact that we have never and will never allow any expired COVID-19 vaccines to be used in Nigeria. I want to assure Nigerians and the global community that our COVID-19 vaccine rollout is built on strong principles of safety, transparency, integrity, and accountability. The Presidential Steering Committee has also stated that Nigeria will no longer accept vaccines with short shelf life, as they not only exert undue pressure on both the health system, but also on the people. Due to vaccine scarcity in the past, we had previously been accepting vaccines with short shelf lives from international donors in order for us to quickly use and provide some level of protection against the disease. Under those conditions, we saw federal, state, and local government health personnel working diligently to ensure all vaccines are utilized before expiration. So far, we have administered over 10 million doses of short shelf life vaccines without expiration. The health workers, the frontline health workers, are the silent heroes, working throughout the week, including weekends, to make sure that these vaccines were used up. We have placed strong accountability and tracking measures to ensure that we track all vaccines to the last mile. Furthermore, the Joint Task Force on COVID-19 Vaccine Monitoring and Accountability is present in all states and working across local governments to ensure that the vaccination exercise is secure against fraudulent and criminal activities. We are aware that fake PCR tests and vaccination cards are now a global phenomenon. We have therefore strengthened the card validation process on our EMIT platform to further guard against vaccination card forgery. May I at this juncture commend our frontline health workers for their hard work and patriotism towards ensuring that Nigerians are vaccinated against COVID-19. We will continue to engage with our donors and partners for better vaccine logistics and stronger technical support to enable Nigeria meet her vaccine delivery target. What we're seeing is that in the last 2 weeks since we launched the mass vaccination program, we have almost doubled the number of Nigerians that are covered compared to the previous 2 weeks before the mass vaccination campaign started. This gives us confidence that the mass vaccination campaign is the way to go to ensure that every nook and cranny has the vaccines to be delivered to all Nigerians. Finally, as the holiday approaches, we would like to reiterate to all Nigerians to endeavor to take advantage of the ongoing mass vaccination campaign and observe the non-pharmaceutical measures to protect themselves against COVID-19. God bless you. God bless the Federal Republic of Nigeria.
We thank you immensely, the Executive Director.
After all, the federal government under President Muhammadu Buhari had done extremely very well in the management of COVID-19. So far, the death has been below 3,000, including the Omicron variant and other variants of this disease, the Delta, the Gamma, the Chinese, whatever it is. And someone said, because we are not testing, I don't agree to that. We are also not going to graves unexplained in Nigeria. In other countries, 1,000 people were dying daily, and we're still at 3,000. So I believe that we've done extremely very well in the interest of our citizens, and will continue to do so. So largely, by and large, once they refuse to delist us, we'll come back to the PSC and sit down as a house and decide the next step to take in the interest of our country. Regarding our relationship with UAE, so there is bilateral air service agreement between Nigeria and UAE as a country. And this agreement is not between an airline and an airport, or an airport and an airline, or business to business. It's between a country and a country. And civil aviation is universally regulated. There is no, I've said on this platform, there's no aviation B. And there is exclusivity in Nigeria, as in the case of that country. It's not on current list. It's the responsibility of the federal government of Nigeria. So there was a convention in 1944 in December in Chicago, which is referred to as the Chicago Convention on International Air Transportation, to which both UAE and Nigeria are signatories. I signed on behalf of Nigeria the bilateral air service agreement in 2017. And that document, before signing it, it was a document that has been negotiated over years or years of negotiations, and come to an agreement of a workable document to describe how we will do business of civil aviation in each other's country. And that document didn't become a legal binding document until when it was subjected to the rigors in the Ministry of Justice of the federal government of Nigeria and the counterpart in the other country. Brought back, discussed in the Federal Executive Council, where every state of the federation is represented, with Mr. President and Council. And it was agreed and adopted and passed to be a binding document between the two countries, before the Honorable Attorney General will reduce it on the instrument to make it lawful and legal, and the President signed that document. And that document is deposited in ICAO, International Civil Aviation Organization, which regulates civil aviation worldwide, because there is no aviation B. And so I would just make reference to the BASA text, which we signed to make a case under Article 2. It says, each contracting party grants to the other contracting party the rights specified in this agreement to enable its designated airline to establish and operate agreed services. And Article 2, Paragraph 2, the airline designated by each contracting party shall enjoy, while operating the agreed services, the following rights: to fly in there, to do all that. It's all stated in this agreement. And Paragraph 3 of the same article, additionally, the airlines of each contracting party, other than those designated under Article 3, shall also enjoy the rights specified in Paragraph 2A and 2B of this article. And Paragraph 5, if because of armed conflict, political disturbances or developments or special and unusual circumstances like this of COVID, a designated airline of one contracting party is unable to operate a service on its normal routing, the other contracting party shall use its best efforts to facilitate the continued operation of such service through appropriate temporary rearrangement of routes as is mutually decided by contracting party. The import of this is that there have been in social media, I am not able to reduce governance to pages of newspaper, while recognizing the need for Nigerians to be brief, to understand the action of government and what we're doing. That's why we're making this brief. Because it has been in the social media, and letter being circulated. And we didn't respond to social media, but we will respond to citizens in an organized manner in such a way that it has the authority of government. Within the context of this agreement, each designated airline shall have the right to use all airways, all airports, and other facilities provided by the contracting party on a non-discriminatory basis. Article 4, as to the actions we took. The aeronautical authority of each contracting party shall, with respect to an airline designated by the other contracting party, have the right to revoke an operating authorization or suspend the exercise of the rights specified in Article 2 of this agreement, or to impose conditions temporarily or permanently as it may deem necessary on the exercise of those rights. Just so that we put it in perspective, Nigeria had been very friendly to UAE and also to UK as regards to the airline. Both BA and Emirates have been enjoying waivers as to the foreign carriers operating permits. They have not followed the letters, they have not conformed with the standards and the regulations they are contained in. But in the interest of mutual respect for country and the need for the services, we had given them waiver and they've been operating those waivers and they have never complied with those requirements, and yet we give them waivers so that they continue to do business in our country. Meanwhile, any airline such as Air Peace that will do business in UAE, they would ensure that those are complied with. So we are not hardliners, we are actually friendly nation, promoting ease of doing business in the spirit of this government. And they have still yet to conform with those foreign carrier operating certificates or permits protocols, but we still give them waiver and they're still under waiver until tomorrow morning. And the letter that started up all this, the social media letter that was written by them, was released, is yet to be on my desk as at 4 p.m. today. I've been in my office until now. I have not received it. And I cannot receive a letter direct from them. It ought to come through diplomatic channels. Article 5, each contracting party shall take all appropriate action within its jurisdiction to eliminate all forms of discrimination and unfair, anti-competitive, or predatory practices adversely affecting the competitive position of the designated airline of the other contracting party in the exercise of their rights and entitlements set out in this agreement. So, having said all of this, we have followed the normal diplomatic route to continue to engage UAE, to respect the letters and spirit of this document, and there are huge signs that we are getting to resolving this matter, and soon. So, distinguished ladies and gentlemen, we have a responsibility as a government to take certain decisions on behalf of the people that are in accordance with the law and that will ensure that our citizens are treated fairly and equally and also enjoy mutual relationships. And finally, there was a question that was asked as regards to a technical question that was asked for, and the National Incident Manager would brief you on that. I had forgotten the real question, so please, if you can ask again the question. I think it's you. Okay, so the Primary Healthcare Development Agency had captured the question and will brief you accordingly. Thank you very much indeed.
Yeah, thank you, Mr. Chairman. So the first question from Reuters was, the expired vaccines had actually been withdrawn way ahead of when they were supposed to expire, and NAFDAC was consulted. So we're working with NAFDAC to schedule a date for when this destruction will take place. There are protocols that NAFDAC and the Abuja Environmental Protection Agency will have to go through. Once all of those are aligned, we will communicate to the general populace and particularly to the media when that destruction will take place, so that it will take place in the full glare of the general public, so Nigerians will know that these vaccines were carefully safeguarded and are being destroyed because there is no intention to use them. There was a question from the News Agency of Nigeria on whether there is a dashboard for the vaccines, when they are received and when they expire. Absolutely right, Rachel. We have that dashboard. That is why it's been crazy, right? That because of the scarcity of the supply in the global community, we had to receive these COVID-19 vaccines. I hope that we have not forgotten so soon the fact that there was a time we were supposed to receive just 100,000 doses of Pfizer vaccine. When those doses did not come, there was an uproar that, oh, we have missed out on 100,000 doses. That was how scarce the vaccines were. In order to take maximum opportunity of vaccines that are almost expired, that have short shelf life, we had to receive this from our donors. The alternative would have been to leave Nigerians without a single opportunity. But at the Presidential Steering Committee and the Federal Ministry of Health, we took the right decision on behalf of Nigerians to accept these vaccines, deploy them quickly before their expiry. And because of that singular decision that is based on science, we've been able to vaccinate over 10 million Nigerians with vaccines that were received free of charge. And this required working round the clock, including weekends. So many frontline health workers have not had a single weekend, apart from the staff at the National Primary Healthcare Development Agency and the Federal Ministry of Health, who have been working to strategize, ensure the logistics and all of the funding are available to deploy these vaccines. This is why I keep saying that the frontline health workers have been the silent heroes all this time, because they never complained about how much pressure they were under just to make sure that these vaccines were deployed. The efficiency of this deployment is on account of the fact that we have a dashboard knowing exactly which vaccines were going to come and how we have to prioritize their deployment across the states, always engaging with states to see the level at which they are utilizing these vaccines. If the vaccines are being utilized rapidly, then we give them more vaccines. If the rate of utilization is not fast enough, then we withdraw from some states and take to those states that have a more rapid utilization. So it has been a very careful, painstaking way. This is part of the reason why we had to establish the mass vaccination campaigns. Before 2-3 weeks ago, we did not have a mass vaccination campaigns because we did not have enough vaccines to go around. Immediately, we started getting enough vaccines, and we were sure that vaccines were available. Then we told Nigerians to brace up, that vaccines were now available, and we were going to deploy them all across board. Recall that we had to start with just health workers, frontline responders, the elderly. Then the vaccines were not available. Now they are available. We're trying to get them across the country. Then you asked whether there's going to be a single day that is set aside for mass vaccination, right? Every day in Nigeria now is a mass vaccination day. So every single day, we've deployed our teams. We've more than doubled the numbers of health facilities that are available, not just the public health facilities, but also private health facilities, some community pharmacies that satisfy the stringent criteria, shopping malls, markets, just to make sure that there is a mass vaccination site near you. If you look, you will find a mass vaccination site at least within 2 kilometers of wherever you live, aside from the fact that these vaccines are now available within the health facilities. So we're calling on all Nigerians to please take advantage of the availability of these vaccines, get vaccinated, so that irrespective of the variant of vaccines that are coming, we're able to actually ensure that we ramp up the vaccination process and achieve herd immunity.
That day? Is that what the science
Sorry,
is
I didn't
saying?
get your question.
I said, is it proper for most especially the civil servants to take this vaccine and immediately go into their office to work for that day? Is that what the science is saying?
The guidance from the federal government through the Presidential Steering Committee is that every federal government employee should show evidence of vaccination, or they should have had a negative PCR test within 72 hours of the day they present at their workplace. I am not sure about this information that you have around officers or staff of the Federal Ministry of Health, just not taking their vaccines until that day. I think the most important objective of requiring that vaccination is to make sure that we achieve herd immunity. It is understandable that because we've just rolled out the mass vaccination campaigns, some people may not have had the opportunity to take the vaccines before then, right? And you cannot penalize people if you've not made the vaccines available. Now the vaccines are now available. If people get the opportunity to be vaccinated, they should be vaccinated, and then they can make their way to their workplaces. Just because you are vaccinated doesn't mean that you should throw away the non-pharmaceutical measures, right? Even if you are just taking your vaccines, you have to continue wearing your face masks. Even if you have taken the vaccines more than 2 weeks prior to coming to work, you have to continue observing those non-pharmaceutical measures. They're right around 1 million doses. Yeah. Yes, right around 1 million, maybe 1 million and maybe 64, something like that. Yeah, but right around 1 million. Thank you.
Acting Chair, Honorable Ministers, gentlemen of the press. There's a question around how many Omicron cases. So far, we've got Omicron cases. As we said, we are prioritizing or actually sequencing samples from travelers that accrued from October to November. And results are being updated like every other day as soon as each sequencing round is completed. We've also shared samples in the sequencing network, and we anticipate by the end of the week we'll also get some more results from colleagues in SGIT in EDEM. I think the other thing to add is that we are also now sequencing positive samples from in-country tests. These are tests that have nothing to do with travel, just to make sure that we get a complete picture of what is going on. Thank you.
I want to thank all of you today for coming, and we appreciate